Hey there, welcome to another Wednesday of wisdom here at Practice Fuel. And guess what? We get to talk about hygiene today. Love it. What I've been doing for 31 years now. Graduated with my dental hygiene degree in 1994 and we're in 2025. So just a couple years in there, right? Well, dental hygiene has changed over the years as far as what our industry looks forward to for patient care. We've added some technology, we've added some skill sets that we can do depending upon what state you're in. And so here in lovely Arizona, I get to use a laser, a soft tissue dia laser. I get to work with patients on airway issues. We get to have, not myself, I'm not a myofunctional therapist, but there are myofunctional therapists out there. So dental hygienists have really come a long way with what we can do in the practice to help patients and to gain experience for us so that we don't get caught up in that mundane day where we're like, okay, well, gotta go in and scale some more teeth today. So what are some things that we look at as a hygienist and as a business owner? So what's cool in Arizona is that you can be a practice owner and a hygienist. As in 2023, that is exactly what I did, was purchased a practice here in Arizona in Mesa. So, I'll be diving in and figuring out, okay, what is the importance? What are the core metrics that we need to talk about? And how do those metrics integrate with patient care? Because I found that over the years, when you work in certain industries or certain practices that you see, okay, there's this focus on solely patient care. And really, when you ask, how successful is your practice, you think about how busy the operatories are. How many patients are coming in? Well, within that patient appointment, how are we building the value? How are we helping patients? Are we, using that first year that we went into practice and just repeating it over and over? Or are we taking the steps to say, okay, within that 60-minute or 70-minute appointment, how effective am I with what I'm educating the patient, my skill set? Is there any tools or anything that I can do that help to make me more efficient? Is there anything that I need to explain to the patient to help them at home with compliance? So we spend an exorbitant amount of time focusing on patient education, patient care, because many of us are very, very nurturing and we want the best care for our patients. Who doesn't, right? Well, as a business owner and a hygienist, it's really gets a little tricky when you start to talk about what is the business side of this, because we want to keep integrity. We want to make sure that we're not over, and I don't want to use the word diagnosing because I know hygienists can't diagnose, but for the sake of a better word, we're not over explaining, we're not over diagnosing with the doctor, co-diagnosing with the doctor on what the patient needs. And we're not undervaluing or underdiagnosing what the patient needs. So when we assess the patient's mouth, and that's what we do, is we are assessors, right? We're assessing what's going on in there. We're creating some findings. What are we seeing? What are we observing? How can we help? So with all of that, how do we also think of this as a business? And what can we do to enhance the patient care and also the bottom line? So one of the metrics I really like to look at is procedure count. So how many procedures are we doing? And then breaking that down by provider. So let's just use laser as an example. So if you have 3 hygienists in the practice, how many laser, what's the code that you use for laser? How many are you doing? And when are the lasers, what is it associated with it? Is it only SRPs? Is it SRPs and perioral maintenance? Is it prophies as well? So what are we associating the laser with? What appointment? And then from that, how much revenue are we creating? then let's say that we're only doing it with SRPs. We're only having the laser with SRPs. Well, is there an opportunity where we say, okay, here's so many perio maintenance that we see, here's the 43, 46 gingival scales. Could we enhance the bottom line with laser? For one, we have to look at what's our practice philosophy. What do we believe in? Because whatever you believe in is what you're going to portray to the patient, right? If you have a practice that believes in fluoride, you hire a hygienist who doesn't believe in fluoride, you're not going to really have the expectation that she or he is going to talk to the patient about fluoride, right? And now there's different products out there like hydroxyapatite that may be another option, or MI paste. So understanding what is available to us and not just saying, oh, it's chlorhexidine, it's this and that. What are the tools and resources that are best for the patient? What is easily put into their routine? How can I talk about this and educate them? And how can I help to grow the business? So as we understand, not every hygienist is a business owner. Not every business owner is a hygienist. So when you blend the two together, you have a different mindset of how impactful the patient care is going to be to help the business grow. So let's say we believe in laser and we want to increase it because we've seen the effectiveness of the healing of the gum tissue. So we look at procedure count. We say, okay, how many are we doing? How many do we have opportunities to be doing more of it? And then what's the system behind that? How do we implement that in? What do we charge? What's our scripting? All of those things come into play, and then we get trained on it, and then we put it into action. Then we reflect on it and we say, okay, so how did that work? This is what our goal was to do, and this is how we did it. Now, 3 months out, let's take a look. How are we doing with that? So that's one way. So that's procedure counts. So taking the procedures that you're doing, looking at how many you're doing, and then understanding your practice philosophy, getting the team aligned on that, and then taking that and saying, what are our opportunities? And then reflecting on that, usually about 3 months into it. Maybe month by month, but really a 3-month assessment of, we implemented this, did we stay consistent with our verbiage? What do we need help on? Is there something that we need additional to make this successful? The other metric I like to track is case acceptance. So if we're looking at the case acceptance of what we're producing, it gives a big picture as to why or why not. Why did the patient schedule? Why did they not schedule? So a way to look at this is day by day. So if you have a patients today, and we have, let's say, 8 patients, how many left without an appointment? 1 without a hygiene appointment, and 2 without an appointment on whatever was scheduled next treatment. And really understanding, what is the patient's mindset as to why they didn't schedule. And then I like to follow up with them in the next week and say, do I have permission to follow up with you if you haven't scheduled? Do I have your permission? So you ask and you say, we know you have a busy life, so how can we help you get this value that you need? So here's the thing. During COVID, during the pandemic, and when we were shut down for that short time, and it was only essential, treatment that needed to be done or emergency care, was 100% case acceptance, right? Because people came in with a toothache. Well, we're at a different time where people are coming in without toothaches. They don't necessarily understand that shadow on the x-ray is actually a cavity, even though we've explained it to them, we've showed them, we've given them the pictures and helped to understand. And so we need to help to explain it in the way that they're going to hear it, not in the way that we are trying to say it. So understanding our patients' connection to what they value is essential in increasing case acceptance. So understanding who leaves without an appointment, why they're leaving without an appointment, and what could we say or do differently to help that patient to schedule. And sometimes it's just a matter of there's going to be patients who aren't ever going to schedule until they are in pain. And, those are the outliers. But 80% of the time, what can we do to communicate to the patient to help them to see the value in it? And sometimes it's care calls. Sometimes it's the ones who are, very analytical, sending them statistics, sending them research behind it. It's when let's say you don't have you really believe in oral cancer screenings and you want to increase your visibility by having Velscope into your practice, and you've purchased this Velscope, you want to get it in there, and then patients are saying, no, I don't want that. So helping them to see the value behind why we want to do this and why it's valuable to them. So what's in it for them? And because as we start going through and adding different things, there's AI tools that are out there now, and patients are seeing the x-rays, and they're seeing some AI techniques on there, and they're seeing all these different things that they know is costing the practice money. And so then we're saying, oh, you need a crown, or you need this, or you need SRPs. And they're saying, oh, well, I just bought your boat or something like that, So, we know that's not true. However, perception's the reality, right? So helping patients to see the value that they need, the necessity of the treatment that they need, even when they're not in pain, based on how they need to hear it. So there's communication strategies that we can help with. There are metrics that we can help you follow, but those are two that I really like to look at, is procedure count by provider and case acceptance by provider. And really honing in on those two things alone will help you to increase your bottom line. Also the patient care, because really, if you're like me, you're not going to ask the patient to do something that, one, you wouldn't do for yourself, someone that you love, and it's really to help the patient in the long run. So I hope that was helpful to you. Please reach out to us with any questions that you have. We will be back next Wednesday to talk about another topic. Comment below if there's a topic that you would like us to talk about. We're happy to. And we love our patients. We love our colleagues. This industry is just something that we're very passionate about helping. So feel free to reach out and we will touch base with you. Anytime we're here to help. Anytime you need help, we're here to help you. All right. Have a great day. Bye-bye.